disorders are usually discriminated, against, including their families, and best believe it, even us as doctors who deal with those patients, we experience a lot of stigma around it. So the whole point is awareness. So I'm going to teach you about mental health related conditions so that you guys understand what it is, and then people don't go around with misinformed things about it, okay? So talking about mental health is an act of courage, especially those that are experiencing those disorders. Compassion and community is very important because, like the exercise showed, we all have to work together. God called us together, not in isolation. So we need one another, all right? And the church can lead by example in love and acceptance, and this is the place where healing begins. It should be, or it shouldn't be a place where there's a lot of judgment. Mental health is very broad. A lot of the times when you talk about mental health, people talk about depression. Not everyone has depression, and not every mental health disorder is depression. Mental health is extremely broad in the sense that there's mood disorders where it's issues around the mood. So remember those connections that I spoke about? All of that is not balanced regarding the mood aspect of it. We've got psychotic disorders where you have issues around your reality, where reality is not necessarily what it is, it's more distorted in the way you see things. There's anxiety disorders, there's personality disorders, there's a lot of them, right? So just for the sake of this talk, I'm gonna discuss the common ones, so anxiety, mood, psychotic, as well as substance use disorders, right? So we'll start with anxiety. Being anxious is a normal reaction. Being sad, being happy, crying, being angry, all of that is part of how God created us, all right? When it comes to it being a disorder, it starts becoming severe to a point that it affects your daily living. So you cannot manage with daily tasks. There's managing relationships, doing your work, if you're going to school, attending school. It affects basically your whole life. You cannot actually function because of the overwhelming of that emotion. So in this case, we talk about anxiety. So there's also different types of anxiety. So we've got generalized anxiety disorder, panic disorder, social anxiety. What that is basically, general anxiety disorders are people who are generally worried about everything and anything. There's no specific worry about it. And when I say worried, I'm not saying you're not working, there's bills to pay, you don't have the money, of course you'll be worried. But when we speak about an anxiety disorder, it's excessive to a point where you cannot function, right? A lot of the times people who experience anxiety isolate themselves. Sometimes they experience a lot of physical pain in the body, so they get muscle tensions, headaches, and people who have panic disorders, they actually have panic attacks on a regular. With anxiety, there's no trigger necessarily, all right? When I have to stand here and speak to all of you, I'm obviously anxious. It's normal. I'm going to be standing in front of people. It's a normal human reaction. It's a trigger, right? With anxiety, there is no trigger. You're just continuously anxious about something that you actually can't even pinpoint and say, I'm afraid of this, okay? And social anxiety, these are people who are afraid of being out and about. So these are people who avoid going to malls, avoid being around a lot of people. You can imagine someone with social anxiety having to give this presentation. They will not be able to. There's a difference with me standing here and my heart beating so fast and maybe I've got a headache and I want to go outside and cool down a little bit. People with anxiety disorders will not even be able to do the presentation as a whole. Sometimes they may even actually pass out and end up being admitted because the anxiety is so overwhelming and debilitating to the body. Alright? And then we've got specific phobias. You're claustrophobic people who are afraid of small places and being trapped, people who are afraid of the dark, people who are afraid of specific animals. I mean, I'm afraid of rodents, I'm afraid of rats, but if a rat comes here, it's not going to be the end of life, right? But with people with specific phobias, it can actually be a mess. I could end up in hospital just because I saw a rat. Again, balance is in the brain. The neurocircuits and all of that, they're not balanced properly, okay? So that's anxiety. So I mentioned that it's excessive worry. It's not the usual worry, it's very excessive. It affects your sleep, your eating patterns, your hygiene. It just affects your life as a whole. As I mentioned, that there's physical symptoms here, so your heart will be racing very fast, there will be shortness of breath. In fact, when they experience anxiety attacks, they explain it as they feel like they're dying. It's like someone is pulling your soul out of your body. It's a very terrible experience to be in. Even patients who experience that, it's not even nice to see. Okay, so those are people with anxiety. And again, like I mentioned, they avoid situations and avoid people. So they isolate a lot. So someone who has social anxiety, try sending them to the mall. It's not going to happen. Because when they're there, they are so anxious. The body is also reacting to the anxiety. So it just doesn't usually happen. And then we'll come to mood disorders. And again, being happy, being sad, being angry, no, but it gets to a point where the brain cannot balance between the two. Okay? So with mood disorders, a lot of people know about depression, but we also have bipolar. So depression is the lower side of it. So it's a low mood, severely low mood, and that comes with a lot of feelings of worthlessness. Like, I mean, if something happens to me, I go through a breakup, of course I'm going to be sad, all right? But it's quite excessive to get to a point where I start feeling like I'm worthless. I don't need anything, I'm useless, you know? So people who experience depression have those feelings. We call them feelings of worthlessness. They experience a lot of irrational guilt, okay? So if you're experiencing depression and something happened in your childhood, say, for example, you were abused. When experiencing a depressive episode, they end up feeling like they are the reason of the abuse. So they focus a lot around all of the wrong things that have happened, and they express a lot of guilt around, even though if you think about it, it's actually not their fault. Okay? It also affects your neurovegetative functions. What that is basically sleep, eating, hygiene, all of that. So someone who's excessively depressed, you also notice that their hygiene is going to go down. So if it's someone who used to doll up, get ready for the day, all of that is changing. They no longer care about how they are perceived in public. They no longer care about their hygiene. The sleep is very poor. Sometimes they sleep too much or sleep too little, or they eat too much or they don't eat at all. And in severe cases, depression affects your cognitive function. What that is memory and attention. Right? So even the way the person relates, you can see that things have changed. If you're working, your work performance kind of drops. If you're in school, your marks start dropping. It's difficult for you to grasp. Because remember, the mind, as I explained, that it's responsible for bodily functions. If there's certain hormones and neurotransmitters that are not working properly, it kind of shuts down the brain as a whole. So there's a lot of low levels of a whole lot of things in the brain because of this illness. Okay? And then there's bipolar, that a lot of people speak about but actually don't understand. Bipolar is basically two poles of a mood. So it's the happy and the sad side. So with being happy, in bipolar we call it mania. It's excessive. It's not the normal type of excitement. It's excessive. They're very hyper. They talk a lot. They're very impulsive. And the impulsive is the problem because then they engage in a lot of risky activities. That's where they become hypersexual. They get into gambling, finances, substances. It's just a mess. And a lot of the times, people who are manic, they take a long time to get to hospital because people enjoy the vibe. It looks like a vibe because they're hyper and they're just all over the place. But it's actually a manic episode, which is quite problematic because even with that, again, affects the cognitive part of the brain, the concentration, the memory. If you sit long enough with those people, when you sit down and have a conversation, you'll realize that something is not okay, right? The way they relate, the way they construct sentences, there's a whole lot of disorganization. So that's the manic part. And then there's the depressed side, which we've already spoken about the depression. So people with bipolar experience those poles, all right? They're either here or there, especially if they're not on treatment. And long-term, bipolar has really bad effects in terms of memory and cognition as well, okay? So depression, as I mentioned, it's a deep sadness of emptiness lasting for weeks or months, where I've explained that your neurovegetative function changes, your sleep, your energy, your motivation, you become very tired, poor sleep, and there's a whole lot of hopelessness. And that is why a lot of the times people with depression commit suicide, because people with depression have what we call black and white thinking, all right? As much as I've explained how the brain functions, the brain also works with rationality. The brain is able to say, you know, this is right, this is wrong, this is how you address this, that's how the brain works. So when you're experiencing depression, remember those low levels that I spoke about? The brain is basically stunned, it's kind of dry, so you can't even think rationally. So with people in depression, it's either I make it or I don't, there's no in between. There's no let me consult, let me speak to my mom or my aunt or somebody. It's either I make it or I don't, and the only way out of this is to work. So that's the dangerous part about depression. So it's not just feeling down, it's severe sadness that comes with a whole lot of other symptoms. Okay? And then bipolar, I've also explained that it alternates between two, where there's a hyper-manic episode and there's also a depressed episode. Okay? They don't usually experience them all at once. So there'll be a depressive episode where you can have it this year. You can have a manic episode 5 years from now. So it's not like this week type of thing. Although there are situations where it's severe, where we call it rapid cycling, where they'll have a depression, manic depression over weeks. But in most cases, there'll be a depressive episode for a year, a couple of years, maybe mania. If you are poorly controlled in your treatment, you can have a lot in a year. Okay? And again, it's not a character flaw, it's a medical condition. It can be managed. And then the psychotic disorders, which are actually very common but also poorly understood. So what psychosis basically means is it's loss of reality. Okay? So remember we've got senses, sense of sight, hearing, smell, touch, taste, all of that. That is in the brain. So again, neurocircuits, hormones, all of that, no balance. Therefore, the senses now pick up something that's actually not there. So these are people who are hearing voices, people who are having delusions. So when we look at patients that are psychotic, we look at 5 things. We look at hallucinations. So hallucinations could be either hearing voices, so it's specific people that are speaking to just you. Only you can hear them. You're the only one that has conversations with them. The rest of the other people can't hear them. And it's not just hearing voices, it's also seeing stuff. It's also smelling things. You know, one of my severe cases I've had is a patient that had visual hallucinations, that every time she went to bed, she would see blood dripping from the gutters. And that's traumatizing. You know, it's not nice. You can imagine someone living like that. It's not a nice thing to go through. So also delusions, these are now fixed beliefs that you cannot challenge. These are people who go around saying, listen, I'm related to Trump, I'm Beyonce, I own this. Different types of delusions. Other people have actually, there's, I don't want to say fun delusions, but there's low risk delusions. I mean, that's okay if you think you're Beyonce, that's fine. Versus if you think everybody's out to attack you and you're trying to protect yourself, you're constantly paranoid. So there's different types of delusions, but they have that. We have disorganized speech, where when you speak to them, you can tell that, you know, the conversation is not adding up, things are going up and way, you know, it's just a messed up type of conversation. There's disorganized behavior, which is what we see. Back then in the days, these are people who would walk around in the streets naked and all of that type of thing, right? And you know how the community would treat those types of people. So that's part of the psychosis. And then we also have the negative symptoms of psychosis, which is basically isolation. So everything drops. Hygiene drops. They start isolating, no longer like active in society or community. Friendships drop, relationships drop. So that's the other part of psychosis. Okay. So the psychotic symptoms we see, they're usually in schizophrenia. So that is one of the leading psychiatric disorders that we have in the world. The diagnosis is schizophrenia. You also see psychosis and substance use. So the tick, the cannabis, the nyalpe, the crystal, you'll see a lot of psychosis with that. And also with mood. So this is now depression and bipolar. In severe cases, they also experience psychosis. So you'll be so depressed that you can start hearing voices that tell you that you're worthless. Jump off the bridge and kill yourself. And in some cases, patients actually listen to the voices, because sometimes the voices are not strange voices. It's a familiar voice. This was my mother, this is my father, or whoever. They say jump off the bridge, and they do. And then they die. Okay. So we have that, and then we have substance use disorders. So now I'm not going to talk about drugs because we shouldn't be doing drugs at all. Let's talk about alcohol. So there's the normal drinking of alcohol, in a party, a glass or two here and there, all right? And then there's the abnormal part of it, where there is a lot of addiction, essentially. So now these are people who sleep and wake up with a bottle. These are people who cannot function without drinking alcohol, including drugs, using drugs. And the common ones in South Africa is obviously alcohol, cannabis, methamphetamine, so this is crystal meth and tape and heroin and nyalpe, and it's getting worse because every other year we see patients who have different types of concoctions of these drugs, because whoever was making this always comes up with something creative to add, and all of this affect the brain as well. Okay. Okay, and also with these drugs, right, they also affect the body. It's not just the mental health. So your liver problems, the heart problems, basically essentially the whole body. One thing that we must not forget when it comes to substances, especially drugs, is the way they get them and the way they use them. Alright? So if we are talking about crystal, some of them are very crystal, where's the needle been? How many times have you used the needle? Alright? Also, the people that are usually caught up in this, they're actually unemployed, which is a social issue that South Africa is facing. Where are they getting the money for that? So either it's stealing or it's selling their bodies. So a high risk of HIV, STIs, and all of this. And as much as you can have a substance use disorder, so a substance use disorder is basically you're dependent on the substance. From drinking 3 beers that don't knock you out, now you want 4, then it's 5, then it's 6, then it's 10, and at some point it's actually no effect. And you cannot stay sober. When you stay sober, you start realizing all your problems, and then you go back as a cycle. Alright? Now, with that, you can also experience depression. Especially a lot of people on alcohol actually experience a lot of depression. And then you also have some anxiety or psychosis. You can have the mental health disorders along with your addiction. All right, and obviously this affects your relationships with your family, your friends, work, and all of that. Okay, next slide. As I've mentioned, so it's basically increased tolerance. You need more and more effects. The withdrawal symptoms, you cannot even stand withdrawal. The moment you don't drink alcohol, there's withdrawal. It's like what we see with Nyalkwe and Crystal. That's why they always hide, because the moment they're clean from the substance, they've taught the body to kind of depend on it from a dopamine point of view. Okay? And then the cravings, you neglect your responsibilities, that's why they end up losing their jobs and all of that. Relationships and financial problems as well get affected. So people struggling with substance use disorders, there's always a story, all right? There's always a story, and we are, especially the church, cannot be the place that judges whether your story is worth listening to or not. There's a lot of trauma behind all of this. There's a whole lot of abuse, there's a whole lot of neglect, or whatever it is that people have experienced that has led them to this addiction when it comes to substances. And with our psychiatric patients, the substance dependence or abuse starts with self-medication. A lot of patients will say, "Doctor, I'm hearing voices, I can't sleep, so I use cannabis to calm myself down." And that's where the problem starts, all right? Including the ones that use crystal and alcohol. A lot of it you'll hear is from a point of self-medication. And we know that with our social circumstances, the poverty, unemployment, community violence, GBV, the crime rates, the peer pressure, social influences. When we talk about mental health conditions being a dual diagnosis, especially in schizophrenia, we call it a bi-directional relationship, where you find that someone has the genetic makeup of having schizophrenia, but because they have the schizophrenia, they somehow kind of are easily influenced because of how they're just made up. When we speak about the cognition, how the brain, right? Then they find someone who introduces them to drugs, and then now it's a codependent relationship. In some cases, it starts with the substances, where the patient uses substances and starts experiencing psychosis. So it can be either or, which causes the other. But in summary, psychosis and drugs is not a good idea. And then also genetics and brain chemistry. So mental health is actually more genetic than you think. So when you sit down with someone who has a mental health disorder, if you sit down and look at the family tree, you'll actually realize that somewhere, somehow, somewhere in the family had a mental health disorder. It's not always like that. In most cases it is, but it's not always like that. Sometimes it's just an environmental thing and chance thing. It's like cancer. Cancer is genetic in most cases, but you'll find just one person in the family that has cancer and some other people don't. So it's that type of thing. And then just this is the cycle of addiction. It always starts with an experimentation from whatever point you come from, whether it's from a trauma point, peer pressure, whatever. There's an experiment, then there's regular use, there's dependence, then there's negative consequences, and then you continue the cycle. With the negative consequences, you start experiencing it when you're sober, and you can't stand it anymore. Okay? So you always have to break the cycle. So remember I told you that mental health is broad, there's a lot of disorders. Okay, so just briefly, I'm also going to teach you about some of them. So we have personality disorders. I don't like getting into detail with personality disorders because it's a very difficult topic. It's very confusing. And for us to diagnose someone with a personality disorder, it's not just me as a doctor. I need a psychologist, the occupational therapist, I need a whole lot of other people. So it's quite complex. So just in brief, these are people who, all of us have a personality, right? From a genetic point of view, from whoever is influencing your life, that you grow up and whatnot, and then become the person that you are. There are people who have certain flaws that are problematic to a sense that it's difficult to live life like a normal person, all right? So people who have social media will know that the word narcissist is everywhere on TikTok, and it's loosely used, okay? These people are not people with great personalities. These are people who actually have serious brain chemistry that is wrong with how they relate in relationships and how they see themselves, okay? So the ones that we know mostly is narcissistic people, because when people break up, people are now narcissists. That's what's common on social media, but it's actually a serious condition, okay? And another one that people don't talk about a lot is borderline. We see a lot of borderline personality disorders. These are now young people who struggle with emotional relations. So they cannot express how they feel. They also struggle with relationships. So they idolize people. We call it splitting. They idolize people. The moment, so say you're their favorite person, you're the best thing that ever happened. The moment you do something that is not in agreement with them, you're now the total opposite. And in a bad way, not in a offended, we have a conversation, I forgive you, and move on. They can't. They don't have an in-between. It's either this or that. And they also have a severe sense of fear of neglect. So everything they attach themselves to, they automatically try by almost make sure that they don't lose it. So this comes in the form of, if you leave me, I'll kill myself. We fight, I cut myself. My mom doesn't want me to go to the party, I burn myself. All of that. It's not always, I mean, some kids are not doing that, but there's the pathological part of it where you see the borderline personality disorder. And with the cutting and self-mutilation, when the patients explain it, they'll tell you that, you know what, the reason I'm cutting myself is because I don't know how to feel. So seeing blood drop down from my wrist means it's pain. So they struggle. They're not like, you know, you and me who can talk when I'm afraid or I'm scared or I'm angry about things. They struggle with understanding emotions internally. And then also they find difficulties with expressing them externally. So those are personality disorders, very difficult topic. And then the next one, we have specialized populations. So we have mental health that is related to children, women, men, and the elderly. A lot of mental health related disorders actually start in childhood. It's just that we don't see them or we ignore them or whatever else happens. But a lot of them, if you sit down with the patient, they actually started being sick when they were 9 or 12 or 13. And you're seeing them when they're 30. So that's a long time of untreated psychosis that is obviously going to be difficult to manage. Okay? So starting with children, children have a lot of disorders, a lot of them. One of the common ones is your intellectual disability, autism and ADHD, the list is endless. Alright, so with intellectual disabilities, these are kids who struggle socially and academically. Alright? These are kids who you usually see it in school. When they start grade 1, grade 2, that's when you see that there's challenges with understanding and grasping. And as they get older, you find that the child is 13 but his friends were 6 because he's able or she's able to relate to those kids. So that's where the intellectual disability comes in. Again, different forms. There's moderate, mild, and severe depending on what the child is able to do and cannot do. There's special schools for that and the support there should be, but our systems are very flawed, but we should have that. Autism, we all know that it's a social neurodevelopmental problem where they also struggle with communication, making friends, and then in school, and all of that. ADHD, we know it's attention, hyperactivity, deficiency, where the kid cannot just sit still, they're fidgeting. Not a naughty normal kid, just a kid who cannot just sit down in class, concentrate, and complete tasks. And a lot of the times when we assess children, whatever that the teacher is complaining about, I also need to see it at home. So it's not just an isolated thing, all right? So that's how we get to the diagnosis. Again, it's not just the doctor, psychologist, OT, and the rest of the team is involved. One of the other things that you can notice in kids is the irritability and poor school performance and isolation. Kids do experience depression, best believe it. Actually, it was very shocking to find out that from the age of 7, kids can think of suicide from the age of 7. Sure. So that's actually quite scary. Right? So mental health does start very early. So with kids that don't go to school, right? It's very important to have a conversation with the child. Let's not assume that the child is naughty and not coming to school, but there's a lot of issues. You might find that the child is experiencing a lot of anxiety in the class, a lot of depression, bullying, a whole lot of things that are going on, or the child is struggling, academically. So therefore, if I'm struggling, I'm always the joke, I'm always being shouted at, I'm going to try and stay away from school, right? So we should take that seriously. Causes, as I've mentioned, genetics play a huge role in mental health, environmental issues, family conflict, bullying, and a whole lot of other social issues. Next slide. And then women. With women, there are mental health related disorders that are related to us women because of the transitions we go through in life. So this is now puberty, premenstrual, menopause, pregnancy. All of that comes with physiological changes, including hormonal imbalances during those times. And as a result, we can experience a lot of mental health related issues. Women experience premenstrual dysphoric disorder, what basically that is, that's like PMS. The usual term is PMS, but this is now a severe type, where the kid can actually not even go to school. They can't concentrate, they become depressive. In some cases, we find it so severe that they experience psychosis during their menstrual cycle because there's a lot of hormonal imbalances and a whole lot of mental health related genetics, so they become very, very, very stressed during that time. They experience a lot of pain, a lot of emotional imbalances, sometimes suicidal thoughts, so it's quite a terrible situation to go through, and also it becomes very difficult because as a girl, you're told you're not the first one to go on your menstrual cycle, so why you cry? not the same, so we should consider that. Yeah? And postpartum depression, we know about that. Sexual disorders, women face a lot of sexual disorders. It's not an easy conversation to have, especially in a community setting, but there's a lot of sexual disorders that are related to the psychological part of the brain relating to sexual behaviors. Okay? And we also see a lot of high rates of depression and anxiety in females. The next one. And then with men, men don't necessarily have a specific one related to their hormones, all right? Because men have testosterone and that's it until we die. But they also experience mental health disorders like any other person. If anything, men actually experience a lot more depression than you actually know. The problem is that they mask it. Why? Because we have created an environment where men cannot speak. Because if a man says, I'm feeling this way, we just automatically rule them out as a weak man. Alright? So they experience a lot of mental health related things, but they mask it with a whole lot of substance use. Okay? And behavioral outbursts. So these, I'm not saying it's right. These are men who now started using, making a whole lot of noise, shouting, beating people up. It's a lot of internal issues internally. Doesn't make it right if it's happening open in case. That should not be an excuse. But I'm trying to say that they mask a lot of their illnesses because they cannot come out. We didn't create an environment like that. Alright? So we need to teach our boy children that it's okay to cry and it's okay to say you're not okay. Because they grow up being told that a man doesn't cry, a man is strong. And when they are fathers, they also don't know how to teach their sons to be vulnerable. So it's a cycle, and it also needs to start here. Okay? As I mentioned, the stigma that men must be strong. And the thing that women are more emotional than men, everybody's emotional. It's just a matter of us deciding who must be emotional. Okay? Men are also emotional. Right? They just don't know how to express it. Okay, and then one of my passions, the elderly. Old people experience a lot of depression because the older you get, the more things you lose. Alright? So the older you get, friends start dying, partners start dying, parents and children get married, move out of the house. Essentially, you're now left alone. And remember back then, by the age of 90, you'd be married with 3 kids already. So from the age of 19 to 60, you had a responsibility of a family. And now all of that is gone. It's now you. Right? So that's a lot of depression that they don't speak about, okay? And seen in dementia as a vision, depression, and a lot of anxiety. Remember, the older you get, the more illnesses you have, diabetes, sugar, all of this. And when you're 81, you're closer to death. When you're 82, you're closer to death. So the reality of death is more real here than it is when you're 21. Okay? So this is a very special population that we need to think about. And because they are old and there's a lot of other illnesses that they're going through, sometimes it's difficult to pick up the depression in them. Okay? But if you start noticing the changes, you know you need to go to the clinic and they can be assessed. Okay, that's elderly. Okay. Alright, so the role of the church is to make sure that there's a safe space for healing and belonging. Leaders, if you're a leader of any congregation or sodality, this is a great opportunity for you to start making sure that mental health is something that's not ignored in your sodality. Yeah, I just want to ask you questions. Obviously, with mental health, we have to create awareness, open and encourage conversations, offer prayer where we can. There is a space for prayer, but we should not ignore the fact that God also made us different, gave us different abilities. Doctors are also a calling from God, so it's Him doing His work in a specific way. So please come to the clinic. Don't think you've got depression, you'll pray it away. Prayer works, but you also need medication. Okay? And then also remind people they should not alone. I'm just going to end here so that I can open for questions if